By some estimates, about 47% of adults get headaches, so they're not really uncommon.
But to have a constant headache for a year and a half, that is highly unusual. Exactly what Larissa Johnson experienced.
And she's here this morning alongside Dr. Drummond from Spinal Balance Health Center. Good morning to both of you.
Good morning.
So welcome to you. The blend for the first time. And we're going to talk about your headaches because you've really had headaches for most of your life. Or how did that work? And they became more severe, right?
That's right. I mean, I started out having headaches as a child, so it's been constant my whole life. But about a year and a half before I started seeing Dr. Drummond, it was a daily occurrence. So go to bed with a headache, wake up with a headache, have it really all day long, and really just try to manage it with aspirin as well as painkillers, which is not always a good solution.
How were you able to deal with being a mom, holding down a job? You've got a headache forever. It's never going away. How did you manage all of that?
I think managing was exactly the right word to use. You know, you would just try to get through every day. And so most days it was just getting home so I could lay down and rest. Definitely not being the type of mom that you want to be, outside playing with the kids. Oftentimes I would cancel going to activities because I just didn't feel like myself and didn't feel like I could be present in the moment. So.
Yeah, I've had headaches before where you bend over to pick the kids, bend over to pick them up, and you stand up and you get that rush and just really a pounding
and
headache.
And that lasts a few hours, not
right, no kidding, not a year and a half.
Yeah.
But did you seek medical help for these headaches?
I did. I saw a whole host of doctors, so everything from family practice to a neurologist to a spine doctor. I did physical therapy. I saw numerous different chiropractors, just really trying to find any kind of solution. And I did everything from taking medication to changing lifestyle, diet, exercise, how much you sleep. Anything anyone offered, I would try.
Just didn't work.
Right.
So then you start getting treatment at Spinal Balance Health Center where they focus on the top of the neck. What did you experience once you started with Dr. Drummond?
Well, I'll be honest, I was very skeptical at first. So I went in for the visit, for the first consultation, and then it took me a while to actually book a next appointment. And fortunately, Dr. Drummond stayed with me and called and answered my questions, but I was very skeptical. I remember going home and telling my husband, there's no way this is going to work. And I tried everything. I was tired of being poked and prodded and tests ran. But I did eventually go because I had nothing to lose. It wasn't going to get worse. All I had to do was gain something from going. And once I started seeing Dr. Drummond, the headaches started to get less severe and farther apart. And I'm not going to say I'm headache-free because there are days that I still have headaches, but it certainly is more often than not that I don't have a headache and I'm back to myself.
Wow.
Yeah, Dr. Drummond, is this a typical case? I mean, she had pretty severe headaches. Do you see a lot of people like this?
Her presentation is unique, but everybody seems like it is. When you start talking about headaches, there's cluster headaches, migraine headaches, stress headaches, sinus headaches, and everybody in any individual category will come in and explain it a little bit differently. So those are all unique. What's probably more common about her than anything else is that she tried so many different things. Most people will, their entry into the healthcare system will be to a medical doctor and they'll try some medications. If that doesn't work, they'll go to the next specialist and on and on. There's never a point in that chain of events to say, hey, go check on some structural issues. And she got to the end of that chain and then was forced to start looking for things on her own. That's common.
Right. Exactly what is upper cervical care and why is it so effective with headaches?
There is a little bone at the top of the neck called your atlas, and when it's misaligned, it will interfere with the transmission of nerve impulses from your brain out to your body. And all of your physiology is controlled by nerves, and this little bone out of place seems to be one of the culprits in many, many different types of headaches. I would say most types of headaches, there's at least a contributing factor upper cervically. So when we correct the misalignment of the bone at the top of the neck, we allow for the nervous system to function better. And in the case of migraines, a lot of times it's blood flow to the head that's being controlled by those nerves. It's not working right. With stress headaches, it's the posture that's affected that causes a stress headache. It's kind of amazing how many headaches come from that area.
Yeah, but it's amazing. That means there is hope because you can be diagnosed. What would you say to someone like Larissa who's watching now, dealing with headaches that they've experienced for weeks, months, years?
Yeah, don't give up. If all you've done is more symptomatic treatments, don't give up. Start looking for underlying structural problems. And upper cervical care is a great place to start because it's just so commonly associated with a headache, and maybe make 2015 Christmas your first one without a headache.
Right, no kidding.
There's no, really, like Larissa said, there's nothing to lose. You come in and we look at you, and you either exhibit the indicators of an upper cervical problem or you don't. But if you have headaches, there's a pretty good chance that you do.
So we asked Dr. Drummond, what does he say to people watching now? I'll ask you that question. And the recommendation, you said you were skeptical. I think a lot of people probably are. So do you recommend it now? And if so, what do you say?
Absolutely, I would recommend it. And you really do have nothing to lose. I think Dr. Drummond is very direct and will tell you, hey, this might be it. We're going to work on it. And if it's not, you didn't lose anything, but hopefully you're like me and it definitely helped and you get some of your life back.
Yeah, and you also wish that other people out there who maybe like you find Dr. Drummond quicker than you found him. So you don't have to go through all those headaches. So Dr. Drummond, how can you find out if you're a candidate for upper cervical care?
You just have to have one of our team, doctor team, to look at you. We're all trained to look at a person's posture, see the indicators of an upper cervical problem. And then if we see those indicators, take x-rays, and then our doctors will evaluate that to find out exactly the type of misalignment you have and how to correct it, and just go from there. Well,
Dr. Drummond brings us a terrific offer for those of you who might be in a similar position. You hear Larissa's story and it resonates with you. The first 15 people who call his office will receive a consultation, an exam, and x-rays, that entire package, for just $50. So let's show you the phone number so you can claim that opportunity. It's 402-452-3400. And if you're intrigued by upper cervical care and this whole idea, the website has some more information there. It's spinalbalancehc.com.
Thanks for coming in, guys. Doctor, good to see you. Larissa, glad your headaches have calmed down a little bit.
That's good news.
Thanks for having me.
Thank you.